Hi,
No.
namaste.
Okay. And where are you at today?
Fine.
Okay. And how are you doing?
Yeah, fine. How about you?
We're doing great. We're doing great. We're having this wonderful conversation about just general practice of medicine, of how to get through the COVID without panicking, right? That be calm and build your immune system and
Of
everything.
course.
Yeah. So what good news do you have to share with us today?
So I think the sir, I was listening to sir. We were discussing about the general instructions on the how to boost up the immunity. I
Yes.
mean, yes. So going through the same line, I think the main concept behind increasing our immunity would be the antioxidants.
Yes.
Apart from that, the natural boosters, like in our Indian scenario, it's the tulsi, and sometimes neems also we follow. And apart from that, uh, just a minute, sorry.
That's okay. This is one thing I enjoy. We're all at home with our children now, and I love it. People have got children and everything, but it's been very, very nice. But sometimes it's hard to hear when you got a lot of things going on in the background. So, all right.
Yeah,
So,
really
children
sorry.
are home, right? Children are home. What a joy.
He just open up the door and yeah.
That's okay. That's
So I
we're all experiencing, new normalities in life, right? That our kids are at home with us all day and things like that.
Yeah, so kind of what we are going through, that the ginger and the tulsi, and what we have, the the apart from that, the neem. So they are the some natural herbal products which there is no harm also, if we, even if we take it, a little bit extra also. So those are the things which helps us in immunity, increasing our immunity, boosting our immunity.
Right.
And apart from that, a lot of
Unbelievable.
hello, hi.
I'm so sorry. What did it? Okay.
Hi. So, share with us a little bit more about the. What are your thoughts on building the immunity? What are some of the things that you think we should be doing?
So I was talking about the immunity boosters. What we have. So one of the common and richest sources in India of immunity booster is the vitamin C. It can be available in the form of the lemon, very easily available, and even the other
Gooseberry.
citrus, gooseberry. Yeah, the one of the
Yes.
richest source of citrus fruit. So even
Yeah.
you can take that also. Even sometimes the other fruits like papaya and all those things. They are, apart from the vitamin C, vitamin A is also very rich in those sources. Those who are bananas. So they are richest source of other vitamins. So they
But
are can also be yeah. So those are things which can be of helpful in increasing our immunity. Uh, Apart from that, having the adequate hydration. I mean, that is the most important key part.
yeah.
To make hydrate your body, and thus decreasing the the severity of the infection. Definitely, get the, if you keep up the immunity up, keep hydrating, infection may catch you, but the severity will not be so severe. So you can have that thing. Then nothing harm also in taking the immunity boosters, like look, which are easily available in our local shops.
So, you know what we need to do, Ankit, because we keep hearing about all of these wonderful things we need to get into our body. We need to have a cooking show with
Yeah.
these doctors, and they go, yes, use that ginger. Yes, this is
Yeah.
what, but Muhammad did that with us one day. He shared with us this beautiful salad and dressing he made. I was
Yeah.
so hungry when he was finished talking about it. It's like the minute the show was over, I'm running to the kitchen going, all right, what do I have? But the thing, what would be cool, because getting out and shopping for these things can be very difficult. Wouldn't it be neat if we can not invent, but create a business where we talk about these foods, but we have these things delivered to the people, right? From the local local community garden or farmer or local community
Yeah.
distributor, and we say each week, okay, folks, this is what we're going to do. We're going to serve you. We're going to have meal time, and we're going to talk about each elements of the meal, why it's healthy for your body, and what's good in it. And then we have those foods delivered to the people. Wouldn't that be neat? I mean, I would like it because I don't like to cook. So,
No, I think that
no,
would
no,
definitely work. If we can have a chef, if we can have a chef and a couple of doctors and an Ayurveda specialist on board, and we can cook something interesting which is healthy, hygienic, and which will increase the immunity, I think that show will perfectly work. What do you think,
To be
doctor?
included in the kitchen.
Definitely.
yes, yeah. I mean, I think in the doctor's kitchen, right? The
Yes,
doctor's
yeah,
kitchen.
yeah.
I think we can start
Yeah.
something ourselves. I've been looking for somebody to do this, but we talk about it, all of these foods. But I think to myself, how can I get that without a pill? I want the food. I don't want to just keep taking pills. Like I try to drink milk every day, right? Because that's supposed to be good for you. And eating a lot of dairy products, protein. How do you get that protein that builds your energy up, that boosts you? Um, and also, we can learn to cater it to people, right? Like maybe we can get an app where people can test their immunity, and then they can call in to us, our doctor team. Maybe we can get a doctor team together. Say, I'm building a business now, and we can get a doctor team together, and the doctor team can say, okay, this is the foods you need to add to your diet, right? But it can be interactive, and but I think the app for immunity building, testing needs to go out. I think we need some kind of immunity testing, because we test cholesterol, we test sugar, we test heart rates. Why can't we test immunity?
Yeah.
And
I think we should work with Dr. Jatin closely because he worked with a lot of infectious diseases, and he understands the how to build immunity and also what are antibodies and antigens. So I think offline we'll start doing something, and then maybe we can launch this program pretty soon on IBM TV.
yeah, because when you're
Sure.
working with infectious diseases, share with us a little bit about some of your research on the infectious diseases.
So, as Mr. Ankit has already highlighted, that there is something called antigen, which can be an something known as infectious agent. I mean, it can be in the form of bacteria, virus, or any fungi. So, whenever it enters in our body, it mounts an immune response in our body. For mounting a good immune response, it means a lot of antibody are being produced against the antigen. Antigen, which we are saying it could be bacterial, fungal, or viral. In this scenario, where we are going through is it's a COVID-19, it's a virus. So whenever COVID-19 or virus enter in our body, it leads to a development of antibody. So depending upon those antibodies production, our body will react. It can go into mild infection, it can go into moderate infection, or even it can go into the severe infection. This all depends upon how our immunity, that is the first line of defense, which we also known as innate immunity. Doesn't matter whether you have been infected with that virus earlier or not. That is the first line of defense. That is the innate immunity which plays into role. Our we have in the body cells known as NKT cells. Those are the cells whenever the virus enters in our body, attacks those cells, and gets them and kills them. So those person who have good amount of antioxidants in the body, those who exercise daily, those who yoga on daily basis, to yoga on daily basis, and also those who have a you know best BMI. Best BMI means, I mean, BMI is adequate at less than 27 or less than 26. Those who are fit. So those are the one which mount a good antibody response against this virus, and these antibodies cope up in fighting this virus. In contrast to those who have poor outcomes, like diabetic patient, hypertensive patient, obese patients, those having the cardiovascular disease. So those are the one who didn't mount any good amount of antibody response, leading to hence poor outcome. So we have to even we are going through lockdown phase, we are eating on an n number of times. But what about our healthy diet? What about our exercise schedules? So they all are going messed up. So even in this lockdown state, I'll emphasize that exercise is a must. One thing. Second thing is healthy mind. So we don't, but nobody talks about the healthy mind. How you can have the healthy mind? Healthy mind can come up only with healthy exercise and healthy yoga. So those are two things. And third is healthy diet also. So with these three, healthy yoga, exercise, and healthy diet, our healthy mind will work. And with healthy mind, our body immunity will boost up. And those are things which nobody taught us or nobody teaches us in the our med school days, because these are things which are comes under the Ayurveda part, not under the our allopathic part. But these are the must. I mean, these are the must things. A healthy mind plays a major role in fighting any disease, whether it's a non-communicable disease or it's a communicable disease. I think this is from my side.
No,
I
I
would
think
like to add
from
one
an
point.
education. That's not just
Just
from
one point.
yourself. That's
Yes,
experience.
I
please,
would like
doctor.
to
Yeah,
add
Yeah,
one
please.
point. As you
yeah,
said, there is a definition for health in Ayurveda, which has been accepted by WHO also. That is samadosha samagnischa. Samadosha means all the dosha, vata, pitta, kapha should be in balance. Samagni, all the three agnis, bhutagni, jataragni, and dhatwagni. And samadosha samagnisha samadhatu, all the seven dhatus should be in balance. Malakriya, all the excretion function should be normal. Prasanna, happy, Atma, soul, Mana, Atma Indriya Mana. Atma, sense organs, and Manas, soul. That is called a healthy state. Samadosha Samagnisa Samadhatu Malakriya. Prasanna Atma Indriya Manaha Swastha Itya Vidhiyate. He is called as Swastha. This is what definition actually. The same as Dr. Saab told us,
yeah.
same thing.
Yes, well, these things we don't know, but the only thing which we know is
Yeah,
every organ has to be controlled by overall by the brain only.
yeah, exactly,
So if our
exactly.
brain is healthy by any means, I mean by yoga, by exercise, or by diet, so
Mm.
our body will be in a good state. It will
Yeah,
not be going to easily invaded by any organism.
different.
I think what we're talking about here is, very good facts, knowledge, and so we don't have fear. But it's about not just surviving COVID, but how to live among all the other viruses that we're going to be, um, faced with in the future. So because we're faced with viruses every day. And viruses that kill people, but not at the volume that we're dealing with right now. But I think these are good conversations that they're not just about COVID. This is about healthy lifestyle to help prevent heart disease, kidney disease, liver disease, but
Skin disease.
yeah, skin disease. And
Yeah,
you're right. And also, Dr. Yu brings this up a lot, especially with stem cell, is about just making you feel younger, right? Like when you eat that thick food, a lot of food that is heavy and not good for you, you feel sluggish, you feel bad, you don't feel good, your heart feels like it's working twice. But when you eat healthy, you feel healthy. When I eat my grapefruit, I feel better. I feel energy. When I eat lemons, I like lemons without sugar. I feel healthy. I think everything we're talking about is we need to teach people how to eat again. We
Yes.
forgot how to eat.
yeah,
It's
sure.
so easy to go get a box of potato chips and eat a box of potato chips than it
Yeah,
is to eat and peel a grapefruit and eat a grapefruit. You
along
know,
with pop.
yeah, and it's more, yeah, pop, right? And
Yeah,
it's more expensive to buy one grapefruit than
yeah,
it is the bag of chips. And I think we need to change that. I think we need, but I think if we teach people good habits, that it's okay to sit there and peel in front of people and eat a grapefruit, it's okay. It's natural and it's good and it's healthy. I eat the peelings. I like to clean the peelings and eat them. I think they're healthy for you because that's where all the sunshine was. But you got to clean them, right? Don't eat the peeling. The peeling was there for a reason, one to protect the good part of the fruit. But I like the whole everything. But I think what we're talking about, we need to get a show on this. I, my boss keeps saying we need a show on this, like a constant show where we eat. But I still like my idea of, let's talk about these foods and then let people order them and ship it to the people.
hello.
Hey, and we got David that keeps popping in and out. Is he having problems with
He's
technology?
having problem, so he's calling me to fix up the problem. So he wanted to join the show, but he's having some difficulties.
Because this is a good conversation for David as well, because
Yeah, this time
he
from you,
does
yeah.
very, very
I'll
good
try
conversation.
one more time. I'll just go out and try one more time. In the meantime, we should
Okay.
welcome Dr. Rajat Gupta. He's a pain specialist based out of Delhi, and he'll introduce himself. I'll take a leave for the meantime.
That sounds good. Um,
Hello, everyone.
hello, namaste.
Hi.
Namaste.
Good evening to you.
Good evening.
It's
Good morning to you.
Oh, thank you. Well, we're almost noon. We're past noon, so it's our days change. You know, and Kit and I do this for 4 hours every day, 7 days a week. We felt the passion to get the word out to people from all of these your intelligent experiences of how we can not just win the war of COVID, but for the future, right? That we these are things we're not just building for today. We want to establish these things for the future. So, how are things going for you today?
Things are going good. We are doing well. The people in India, though the numbers are increasing, but we guys are fighting out, and we are very positive. And we are trying to find out vaccine and different solutions to the disease. So hopefully, we'll be able to get a control on that.
You know, we've been talking about a vaccine. China claims they have a vaccine, and we've been working with Dr. Yu. He's been on our show. He comes on 3 days a week. He does stem cell research, and there's another doctor, Dr. Stein, that's in Vegas, and he's doing stem cell research, which seems to be a healthy alternative for vaccines if we can make it work. There's a lot of controversy with stem cell, but I've learned a lot through them that they're not just taking stem cells from anywhere. And they're very, very healthy and mindful about the use of stem cells. So, very interesting research. They use stem cells right now for pain. You know, that they're just generally taking good, healthy cells, and if they can find the right receptor in the body, they can put that healthy cell in the body and let it regenerate what has been damaged. Because that's what our cells do, right? Until eventually they don't have the immunity to do that anymore until we get older. Those cells get older. And so I've learned a lot watching that. What are some of the experiences? You said that you're seeing an increase of the infections.
The whole idea behind this
Link.
I think we're having some difficulties.
Not audible.
So, in infectious disease, what is your thoughts on Dr. Hoju? What is your thoughts on stem cell research?
Already, I think 2 days back we were with Dr. Philip. I think Dr. Philip Yu. He was already on the a lot of research he has already did it on this topic. Even the one of these research is going on with the help of Israel and I think some hospital in New Jersey. I think they were on the PLX, I think plaque cells. It's a kind of a extract derived from the placenta, and those are the cells which are pluripotent. Means they have the capability to convert into any active cells, any kind of active cells, and those have the capability as to act as an immunomodulator, just like our hydroxychloroquine, which we say it's an immunomodulator. It's an anti-malarial drug, but by an immunomodulator, it can help in controlling the virus part. Similarly, with the PLX cells, whatever we call the pluripotent cells, they can be acting as immunomodulator. Also, they have been using it. We have been using it earlier also for the regeneration tissue, for regenerating the tissues like any chronic insufficiency in the lower limb or any kind of dead muscle regeneration. So those are the things we have been used in the past in terms of regeneration of the tissues. But to tackle this virus, I think it will be a new venture for us, and hopefully if it comes out to be successful, that will be the winning part of the whole humanity. It can be utilized because company has already claimed that even if it comes out to be trial comes out to be successful, we'll be producing a lot of PLX cells that can be used both in the Western world as well as in the Asian countries also.
And I agree with you. And my whole thing too is some of the stuff in research of stem cells is why not utilize things that are already in our bodies and in our DNA rather than creating something that is of foreign substance to the human body. To recreate it and help it rebuild and become healthier, just like what when we're putting healthier foods in our body, right?
Yeah.
And I'm going to be drinking a lot of turmeric. Ankit tells me this all the
Yeah.
time, and we've got a lot of input on that. I think I'm going to start selling it. It's, but all of these things are healthy. Some of the things that we've been talking about is the mental state of mind. We talked about that today, which I think is very important. And when you're fighting any kind of disease, infection, viruses, pain, Dr. Gupta, I think people need to be in the right mental frame of mind when they're in pain. I know I learned a lot by going to a pain psychiatrist years ago to help learn to live with my disease. Um, because you have a tendency when you have a chronic disease to sometimes get depressed. You're not feeling good. You're not sleeping good. You don't sleep good. All of these things happen. But when you have knowledge, you have no more fear, and you know how to fight. But knowledge comes also with strength up here. What are some of the things that you're seeing with the climb of the infectious rates in India, Dr. Gupta? Are you seeing some of the pain?
Yeah, we have been seeing a lot of patients with cancer pain. So chronic pain patients are not regularly following up because of the scare of COVID, but cancer pain patients have to follow up for their opioids refill. So we are seeing a huge number of cancer pain patients coming in. These patients are already very depressed and they are fighting with a tough disease. So probably COVID is not affecting them that much. But yes, we are trying to encourage them, motivate them, and tell them not to worry. And coming back to COVID, and so there has been a lot of research into plasma cell therapy.
Awesome.
So they are taking plasma cells from the patients who have recovered from COVID, and they are said to have rich in antibodies against the COVID virus. And they are trying to transfuse that into patients who are terminally ill with COVID-19. And we have been doing few cases and have got very good positive results. So let's hope that this plasma cell therapy is also a boom to treat COVID patients.
Awesome. Where are they obtaining? I mean, this would require a high dose of plasma. How are they obtaining all the plasma right now?
So they are targeting the patients who have recovered from COVID-19 and
Awesome.
have been discharged home. And they are encouraging them to come back to the hospital, donate blood. They are collecting the plasma out of that blood and retransfusing the blood back into the bodies, and then transfusing that plasma onto the patients who are on ventilators or critically ill. And there are 5-7 cases which we have done so far, and we have seen good positive results. These patients are recovering.
Wow, that is such good news because that's a good solution. That seems to be an easy
Yeah.
solution.
And they say that this has been tried in the past also for Ebola virus and
Yeah.
polio and other various viruses. So probably the old therapy is working. So let's hope. Let's keep our fingers crossed.
So,
Yeah.
Dr. Gupta, is that means that the therapy works for all the patients, or is there any bifurcation based on the plasma therapy?
Ankit, it is still very, very fresh. Cannot comment whether it's going to work for all the patients. So far, we have tried it on 5-7 patients. They have recovered. But once we get the okay from the central government and we try it on more number of patients, then we'll get to know about the failures and success.
I
I would also like to take a view from Dr. Jatin as well regarding the plasma therapy. So, Dr. Jatin, what do you think about the plasma therapy, and what kind of treatment we are seeing in future using plasma?
Yes, I think the even the Delhi government has started this initiative in terms of from the social media also and from the television part also, that more and more people who have been recovered from the this COVID-19, they should come out, and even the government will help them, will facilitate them to come from their home to come to the hospitals, give their blood. That blood can be utilized, if the depending upon the antibody titers, if they are high, they can be utilized from for two patients for the recovery. If the antibody levels are not so much high, at least, in fact, adequate also, that can be utilized for the this one person life saving can be done. So convalescent plasma, any patient who has recovered, who has no fever, 2 weeks have been passed, patient has already mount the IgG antibody response, and he's totally afebrile. Those are the persons. Our role is to promote them, to educate them that yes, you are totally healthy, and now there will be no problem if you come out and give your blood. That blood can help us in treating many patients. So even not about research, we can save life, we can do research, but it's a humanity work. It's a humanity, because if people who have recovered, they have the good immunity, and they can give their blood. There's no harm in giving blood. I mean, everyone should give blood after every 3 months. I mean, that's the whole concept. There is no doubt about it, whether you are COVID positive or COVID negative. But yes, if you are COVID positive earlier, you have recovered, then you can save life in terms of for those who are severe COVID pneumonia patients. So in India, I think this is a new concept which is going on already. Western world has tried, and some sort of even success has already been received. In India, we have treated 5 patients so far, 5, 6 patients. The results are really good in terms of that. Second thing is, those patients who are coming in contact, they will also mount some herd immunity also. So to what about the ending of this COVID-19? So we see ending of this COVID-19 pandemic by three ways only. One is by development of the herd immunity. Second is those who are having comorbidity, so they should receive convalescent plasma. And third, which is a remote possibility so far from now, that is the development of the good adequate vaccine. So only these three are the measures, I think, by which any country will come out of this pandemic.
And also, I mean, what our viewers would like to know, is plasma therapy a painful therapy for them, or is it as same as the other therapies? Dr. Rajat?
It's like blood donation.
Blood
There is
donation. Okay.
there is nothing. So there is no scare or anything. It's
Okay.
like donating one whack of blood. So that's all.
that's
Is
it.
it
And
like
how much blood?
is it like a dialysis treatment where we just take a blood out and then put in from? Is it
Ankit,
like
that
that?
seems that you have never donated blood.
No, no.
Blood
I have
transfusion.
done it. I'm just trying to explain for my viewers. I mean, what happened with the
No,
vein.
it's like blood donation. You put in a cannula and
Okay.
you just put in a drip. You take out blood and you transfuse it back. That's all. So you have
Okay.
cannula in. That's a single prick. That's it.
I'm just curious about, is it taking just one transfusion, one bag, or I mean, how much is it taking to help the patients?
So 1 unit of blood will be sufficient to from 1 unit of blood, whole blood. What they do is they extract the plasma part, and
Okay.
the rest of the blood, if required, can be given for as a packed RBCs for any other patient. But for plasma part, we extract it from the segregating machine, and then that can be given to the desired patient.
Okay.
And also, if something is, I mean, if that the other person is suffering from some kind of a disease, or maybe something like diabetes or any chronic disease, would that also carry forward to that other person? Or I mean, is it not not the
No
way it
other
goes?
comorbidities is carried through to the other person. It is only
Okay.
the viruses, and you screen the blood for the HIV, hepatitis B, and hepatitis C. Apart from
Okay.
that, only bloodborne infections can be transmitted. Hypertension and blood sugars, diabetes
Blood sugar.
cannot be transmitted.
Okay.
I think
I
Dr.
think Dr.
Drew is
Chemistry was,
interested in the conversation that we're having about the
yeah.
success rate with plasma, and he wanted to beam in. We beam in and out just like we are on Star Wars.
You mean the plasmapheresis, where you take somebody who has the antibodies to COVID because they developed the IgG immunity, and you can take their plasma and you could IV that in somebody infected and give them the immunity, correct?
Yeah,
They're
correct.
recovering. They're not just immunity, they're recovering. So they're
Recovering.
taking the plasma and putting it in patients that are sick, and those patients are recovering.
Well, yeah, you're giving them the immune factors
Yeah.
to fight it. Yeah,
So
same
they're
thing.
but they've had every one that they've done this to has been successful. So this has been good research. So
So, what is the mechanism? There must be some the growth factors or the umbilical cord blood or
no, it's just
hematopoietic stem cells must bind to the ACE2 receptor to block, to block the COVID virus to lock and key on the ACE2 receptor so they cannot replicate. Is that one of the mechanisms?
I don't. I think they're just doing blood transfusion, the plasma
No, I'm
transfusion.
asking the specific mechanism of that.
I don't know. One of you?
So in the convalescent plasma, this just like already you have been infected with those particular virus, and it's antibody production. And once you have the antibody production with